snap after snap.
Good.
Megan Muncie models for the camera. Hard to believe, she used to hate having her picture taken.
I just thought there was no hope for me.
Even harder to believe, the bubbly 16-year-old sitting here used to look like this. A shy teenager, 135 pounds heavier. At 14 years old, she was pre-diabetic with serious health problems.
I had like knee problems and back problems and ankle problems.
And her classmates were brutal about her weight.
I really didn't want to go to school. I got teased every day in middle school.
Megan's mother, Debbie, began worrying that history was repeating itself.
I had been overweight since I was little. I knew what she was going through. And I thought, we've got to do this. It's got to change.
Megan started the Healthy Weight Program at Nationwide Children's Hospital. With diet and exercise not working, she and her mother made a dramatic decision for Megan to have gastric bypass surgery.
People who have that operation can expect to lose about a half a pound to a pound a day for the first 18 to 24 months after that operation.
Dr. Mark Mikulski is the surgical director of the Center for Healthy Weight and Nutrition at Children's. He says decisions about surgery are not made overnight.
Our patients undergo a very rigorous medical assessment that usually takes several weeks to several months to complete.
Patients only qualify if they're more than 100 pounds overweight. They also need documented proof that they've tried to lose weight through a medically supervised program. But Dr. Mikulski says when teens are that obese, it's difficult for diet and exercise to do the trick.
The ability to lose a significant amount of weight on your own or through medical weight loss is really very low.
The hospital offers 3 surgical options for teens: gastric bypass, a gastric sleeve, or a gastric band. All 3 have significant risks that are weighed before surgery. The procedures limit the amount of food patients take in at one time. In the beginning, weight loss is dramatic.
I think in the first month I lost 30 or 40 pounds.
How would you sit in the chair?
2 years after her surgery, Megan is eating 5 small meals a day, and sugar is a no-no. That means no more Twix bars, her favorite.
It was hard at first, especially around Halloween, because I had a major breakdown the first Halloween after that.
But she's stuck with it and has had some major breakthroughs.
The first thing I really noticed, it was school, because the year before I couldn't really fit in the desk at my school. And then last year when I went back, I could fit in the desk.
Hold at your waist level.
And her mom says it's like she's a whole new person.
It's like a butterfly, opening up where she was always in a cocoon, and now she's that butterfly that has her wings open and she can go anywhere and do anything she wants.
Her mother, so inspired, she's preparing for her own gastric bypass surgery now. As for Megan, she notices differences every day.
I can run a lot faster. I can run a further distance.
Now she's running towards a future she never thought she'd have. At Nationwide Children's Hospital, Megan McCorkle, ABC 6 News.